Hi, welcome to Senior Moments Successful Aging. My name is Mary Beals-Ludka, your host. Senior Moments Successful Aging is co-sponsored by Yavapai College, Division of Lifelong Learning, and NACOG, Area Agency on Aging. Our producer is Jody Bueller, and if you want to get a hold of Jody, you can call her at 717-7607. She'd love to hear from you, maybe comments about the show or ideas for things you'd like to hear about from us. And again, welcome. If you want to get a hold of NACOG Area Agency on Aging, and I'll repeat this number later, you can call us toll-free at 877-521-3500. Today we have a guest from NACOG Area Agency on Aging, one of my staff, Frank Brown. Welcome, Frank.
Hi, Mary. How you doing this morning?
I'm good. Thank you so much for joining us.
Well, thank you for inviting me.
You know, we're here today because, there's so many changes in Medicare and so much that's going on. I need to catch up with you, and I know our viewers need a little catch up too, because it seems like it changes constantly. So I want to start out by having you explain what your position at the Area Agency on Aging is.
Sure, Mary. I'm the Medicare Benefits Coordinator with Area Agency on Aging, Region 3. I cover 4 counties, which of Navajo, Apache, Coconino, and Yavapai. There is 12 volunteers and 2 staff members that assist me in covering the assistance that we give to the clients in those 4 counties, which include Medicare assistance in open enrollment periods, prescription drug plan assistance, also with appeals processing with Medicare, as well as Senior Medicare Patrol for fraud and abuse. So we're also a go-to location for people that are having problems with their Medicare summary notice, maybe getting overbilled, maybe getting bills that they're not supposed to be receiving. We assist them with those issues.
So really the services are varied, but they're kind of all around Medicare.
And public benefits.
And public benefits?
Yes.
Okay, because, those are very complex programs, all of them. Mm-hmm. So today I just want to concentrate on Medicare so I can kind of get a handle on all the changes that have happened. So you mentioned the services that you provide, and you can also be reached on that toll-free number, right?
Absolutely.
Okay, so
yes.
It's 877-521-3500, and you can ask for somebody to help you with Medicare or public benefits, and they'll connect you to the appropriate party, yes. Which oftentimes is Frank, and you're actually in Flagstaff, but you travel down to our area in Prescott a lot.
Yes, I do. In fact, I cover all 4 counties on at least a quarterly basis.
Okay.
And of course, the staff members that assist us are located one is in Lakeside at our new facility, ADRC, the Arizona Disability Resource Center, mm-hmm. In Lakeside, and also in our Prescott Valley office to assist the volunteers in scheduling counseling appointments for the clients that need assistance.
So they don't, sometimes you can't just answer a question on the phone. You've got to meet face to face.
In a lot of cases, depending on what the issue is,
okay.
We schedule those appointments, you bet.
That's really a great service. So I know that there's a lot of changes. So what can we expect in 2012 for deductibles and co-pays, that kind of thing?
Well, for 2012, there has been a lot of changes in deductibles and co-pays. And starting with Part B premiums, everybody's premium will be at $99.90 in the year 2012. This is going to change a little bit for everyone. There is a $3.50 increase for people that have been in Medicare for over 2 years. But on the good side of this, there is also going to be a cost of living adjustment. So everybody should see at least a $30 to $40 increase in their Social Security check.
Okay. So that's going to help offset what they have to pay more in Medicare.
That's correct.
Okay.
Yes. Now, the people that have aged into Medicare in 2010 and 2011 were paying a little more, mm-hmm. $110 and $115 for those 2 beneficiaries, and they're now going to be at $99.90 also. So everybody will be at the same level starting in 2012 for Part B premium.
Boy, I am behind, because I can remember when premiums were a lot less than that. So, but it is nice that they're evening it out. Boy, say that fast.
Yes.
Evening it out. So I know you briefly spoke about enrollment. And I know there's different enrollment periods throughout the year. I know there's special enrollments and open enrollment. So what are the dates for the open enrollment every year?
Okay, right now, everybody that's in Medicare right now is eligible for the open enrollment period. It begins October 15th and it ends December 7th. Very important dates to know now because they have moved back 3 weeks. Used to end December 31st.
Okay.
So now, if you're not enrolled in a plan of your choice, Medicare Advantage plan or a prescription prescription drug plan by December 7th, then you may not be able to enroll in this plan until the next open enrollment period.
Ooh, that's not good.
Yeah.
So, and I remember last year because you worked through Christmas. So
Yeah.
that's probably nice for you that it's not through the December 31st.
Yeah.
So each year there is an open enrollment period.
There is, correct.
Yeah.
And one of the other reasons that they changed this date was so it would give the insurance companies time to process the paperwork so people will have their insurance in place come January 1st.
So what's the difference between special enrollment and open enrollment?
Now, the special enrollment is for individuals that have just aged into Medicare, or they may have been disabled and they have been on disability for 24 months. These are the two times when, of course, you would be eligible for Medicare during what's called the special enrollment period. Now, this is a 7-month span, and that 7-month span for you to enroll in a plan of your choice, which can be either a supplement policy or a Medicare Advantage plan.
We'll talk about that. I need you to explain that to me.
But that 7-month span is 3 months before your 65th birthday, the month of your birthday, and 3 months after. And the same goes for when you're become eligible for Medicare through disability.
So my birthday's June 13th. If I turn 65, it really would be better if I started looking into it before my birthday.
That's
So because I've got that 3 months before, but I also have my month and then 3 months after, right?
correct. Yeah,
Okay.
it's always best to always look at them. Try to get enrolled before the month of your birthday,
Okay.
because it does
That's
not delay
important.
your Part B premium, which is your outpatient services.
Yeah, and it's important to keep that smooth, especially if you're retiring. I don't know if I'm going to retire at 65, but that's a whole other ballgame. So special enrollment also is for those who are disabled. And is it still that once you're deemed disabled by the Social Security Administration, is that correct?
Correct.
Then you can apply for Medicare after you've been on it for 2 years. Is that still the same?
That's still the same
Okay.
at this point, yes.
Okay. So if I've been on disability for 2 years, it's time for me to look into signing up for Medicare. Now, does Medicare necessarily notify you before your birthday, or is that something that you really need to take the initiative on and perhaps call our agency and get some help?
Well, Mary, actually, if there is a way that that Social Security knows that you're already eligible, and that would be if you are already receiving benefits from Social Security. So if you're receiving a retirement check or a benefit or a disability benefit, whatever the case may be, then you're on Social Security's radar, and they will send you the paperwork automatically 3 months, or they should at least 3 months beforehand.
I think should might be the shoulda, woulda,
Yes,
coulda.
shoulda,
Were we
yes.
talking about that earlier?
And this is something that I do mention in all my presentations, is that if you don't receive the paperwork within that 3-month span, call Social Security and let them know so they can get your paperwork to you and your Medicare card.
But also they can always call the Area Agency on Aging and say, I'm not sure what I heard on Senior Moment, Successful Aging, or I'm not sure what I got in the mail. I don't understand it. They could call the Area Agency on Aging, ask for the Medicare counselor, Frank, and get some clarity.
Absolutely.
Okay, because that's important to know, because sometimes there's so much stuff coming at you, especially if you're planning retirement. Because you've got so many things going on. Let's say I'm going to retire at 65. I've got Medicare to think about, Social Security to think about, retirement stuff. Yeah, so it can be overwhelming.
Yeah, and employee group health plans even play a role in this too. If you decide, like we mentioned, if you plan on working past the age of 65, in a lot of cases we assist clients in coordinating their Medicare benefits with their employee group health plan.
That is a wonderful service. And I think the thing that I want to point out, and correct me if I'm wrong, because you're the expert in the program, is that the thing that is so good about calling the Area Agency on Aging is you're an impartial person to bring them information about different plans. So you're not selling a plan, or you're not pushing one plan over another as far as the companies go, because I know you see a lot of these Medicare presentations out in the community, and my concern is it's being put on by a commercial company.
The most important item to know about our program as well, Area Agency on Aging itself, is that this program, we are not insurance agents.
That's right.
We are unbiased, and also we are funded totally separate than the way agencies are actually paid for, which means that we are unbiased in all of our information. So you're going to get all of the different choices, not just what an insurance agent may show you.
Right. Just the facts, ma'am, right?
Absolutely.
So you can make informed decisions for yourself, and that's part of successful aging.
Yes.
Is having the tools. Oh, how do I want to manage my life, and how do I want to age, and how do I want to manage my insurance, and the tools are just so crucial. So I want to talk about what is a Medicare Advantage plan, and what is a supplement plan, because there's just so much of that thrown out, and I'm not clear because I think that's changed.
I'm glad that you asked, because this is the first part of actually knowing which type of plan to choose when you're looking at filling the gaps in original Medicare or opting into a Medicare Advantage plan to take care of your health care for you. And there's a big difference between the two. Now, supplement policies on one side are federally regulated plans, and they're letters A through N, and they are sold by private insurance companies that basically what they have control of is the cost. So these supplement policies will have monthly premiums anywhere between $85, maybe $185, depending on how much or how little of the gaps in Part A and Part B, which is your inpatient and outpatient care, will be covered. This has nothing to do with prescription drug plans.
Okay, we'll talk about that separate.
Absolutely, yeah. So this is just for your hospital inpatient and your outpatient services. So these will cover the gaps that Medicare does not pay. There is a premium. Now, on the other side, where there's Medicare Advantage plans, these are more known as pay-as-you-go plans. They are low to no monthly premiums on these plans, so they're more affordable. They may be lower cost out of pocket because you're not making that monthly premium as you would be with a supplement policy. But when you go see the doctor, you'll have a low copay, and if you see a specialist, it may be a little bit more. So they call it a pay-as-you-go. So it's not as much out of pocket. And then, of course, if there is something that happens where you may need a surgery, they do have caps in these programs where they can go anywhere from $4,300 to $6,700, which is the cap that Medicare has placed, that you may be out of pocket annually for services through a Medicare Advantage plan. So both plans just you have to look at, first of all, of course, your income. Level between the two is the first question you need to ask yourself. Second question is, how much or how little health care do I really need? And one gives you pretty much the whole gamut. The other one covers you for what you need when you need it. And that's the first questions that you need to ask yourself before you start looking at the plans.
Yeah, what's the right plan for me? And again, calling somebody and having one of us help them sort through that, because I mean so Advantage plan. I know we heard a lot about that in healthcare reform, and I know that was one of the outcries from the seniors. Oh, healthcare reform is going to take away Advantage plans, and truly that's not what happened. What they did is they leveled the playing field so that Advantage plans get the same reimbursements as the other benefit plans. And originally they got more because the government wanted us to have some Advantage plans. So the big companies, they're not going anywhere. They still are able to offer that to our persons that need Medicare. So,
absolutely. In fact, in the Medicare Advantage plan, there is a new program that's been opened up on the Medicare.gov website called the Physicians Compare website. And you can actually go into this portion of Medicare.gov and compare physicians in your area. And they have a grade scale system, and Medicare is actually paying them for the performance of getting these better grades. The providers and doctors that are on this list, and in return they get paid a higher amount for their services, and in return the clients that use this program go online and check these doctors and providers and use them will also be assured full service from their provider or doctor.
Well, that's a wonderful thing to be able to look up. So it's just Medicare.gov.
www.medicare.gov. G-O-V. Yes.
Okay, great. And then they go in and just look for providers?
There's a link that's right on the homepage where it says right on a Physicians Compare website.
Well, that's an excellent feature. I didn't even know that existed. So, and I know sometimes it's difficult when folks move into our area to find a doctor who takes Medicare, and that would be the perfect place to start. Let's go in there and can you put your zip code in?
It is all zip code specific.
And say, okay, where are the doctors? Where are they?
Yes.
Now let's talk briefly about the prescription drug plan. Where does that come in with when you sign up, open enrollment, all that good stuff? Maybe if you could start with square one, because I'm a little behind on that.
Okay. Prescription drug plans, first of all, are required for a beneficiary to enroll into the plan.
Okay.
And now, of course, if you have what's called a creditable coverage, which means that you may have an employee group health plan or a private insurance that has at least as good or better than what Medicare has to offer, this is called creditable coverage. So if you have that, you would not need to enroll in a prescription drug plan, but when the time comes, you would need to get what's called a creditable coverage form. So most people that come into Medicare don't normally need this, but if you're working and you are retiring and you're planning on moving over to Medicare, this is a form that's very important, because if you don't have this form, they may charge you the penalty of 1% per month for every month that you don't have creditable coverage.
Let's back up just a little. So when you say it's required, that means if I'm going to be getting Medicare coverage, I have to pick a Medicare prescription plan. Well, is that what that means?
It means that if you don't, you may be penalized.
Right. So if I don't sign up right away for that Medicare prescription plan, Part D, D as in dog, then, and a year later I sign up, I'm going to be penalized at 1% for 12 months because I waited 12 months to sign up. Is that how it works?
That's the basic formula.
That's the basic formula. And, and you can help with that, right?
Absolutely.
If people have questions. So bottom line is you need to sign up for a Medicare Part D plan.
Yes, and it's kind of like insurance with your car.
Yeah.
The only difference is, of course, being legislated that you don't get to go back to the normal cost after 6 months. That penalty stays with you for as long as you have Medicare.
For the rest of your life, basically.
Absolutely.
Oh, so it's really important that folks know they've got to do that.
Yes.
Yes.
Now after you have looked at the plans, which there are 30 plans in Yavapai County that are available, prescription drug plans only.
Oh, that's good.
So I mean, there's several different ways. There's several different ways to actually look at the plans. Now, some of them actually will cover the deductible, which in 2012 is $320. And you may pay a little bit more. Some of the plans start at $23 and go up. That will cover that $320 deductible, and you just start paying co-pays right from the start. And once you're enrolled into the prescription drug plan. Now, and other plans are underwritten a little different. Depends on the formulary that you have, which is the medications that are on your drug plan, in your drug plan. Also the cost, the monthly premium, of course. And then you have there's one other, and anyway.
Well, let me ask, and then we'll go back.
Yeah, that's.
Okay, because that's confusing, really. I mean, if you've got 30 plans, so is that something that you can help with? If folks to look through those Medicare Part D and kind of help sort them out a
yes,
little
absolutely.
bit?
We help with the we don't choose for you, of course, but we give you the options. And of course, being 30 out there, we have a prescription assistance form that we have you fill out.
Okay.
And then it basically narrows it down to 3 choices based on your healthcare needs.
See, that's a wonderful tool too, because 3 is a lot better than 30. I couldn't choose between 30 pair of shoes, so let alone my Medicare Part D plan. So you've got a form, and it's a form that you fill out, and it's computer generated, isn't it? Is it?
It is.
Yeah.
And it's actually, you can use it a couple of different ways. One is you can set an appointment to have either myself or one of our volunteers assist you with the input, or you can go to the www.medicare.gov site and input this yourself and use the form as a cheat sheet, because it asks you all the questions that they're going to ask you on the website.
And that's good to know. So you can go in and put your information in the computer. It's totally safe. And I think the one thing that you brought up I think is really important is, what medications are you on now? And is it on that formulary? Is the plan going to cover it? Because I know I've seen some of the formularies, they'll leave out certain medications, and then if you don't pay attention to that and you sign up, you have to wait a whole nother year to change it?
That's correct. And actually there is what's called an annual notice of change letter that comes out in September, which is part of the it's the date timeline that I have set up in my presentations.
Okay.
Is the first is when you're changing. Now this is after, of course, the special enrollment period.
Right.
Now when you're in an open enrollment period, you get to change that if you'd like. check every year.
Okay.
And the first step in looking into changing your prescription drug plan is to look at your annual notice of change form that you should be receiving in September, October. Take a look at that form. If your price has changed, if your formulary has changed, if they're changing the locations of the pharmacies that you may be eligible to go and use this plan at, then it may be time to look at other plans that would better fit your budget or formulary, whatever the case may be. And then, of course, make that change between October 15th and December 7th.
Sounds like fall's an important time for Medicare. And I think another thing to point out is I know before I got into the aging business 20 years ago, I thought, gosh, when I retire someday, I'm going to get a Medicare card and my healthcare needs are going to be covered. And that just isn't the case. It is not the case. Is it still maybe 50% of your healthcare is covered by Medicare?
Well, actually, depends again now, with the Part A, which is your hospital inpatient care. Now, if you're in original Medicare, that inpatient service being admitted into the hospital has an $1,156 deductible in 2012.
Yeah, see.
So that's an original Medicare. That can be a steep cut where you can actually lower that amount out of pocket by either filling the gaps with a supplement policy that covers that inpatient care, or paying a lower cost for daily inpatient care through Medicare Advantage plan. So,
well, I think another question is that it seems like anymore the hospitals they very seldom admit you. Usually it's outpatient.
Yes.
I mean, I had surgery and they whisked me out of there in 3 hours. It's bye, go home.
Yeah.
So then it doesn't qualify for inpatient. So then if it's an outpatient, does it go to Part B?
Yes.
As in boy?
Yes, it goes to Part B for outpatient services.
I think that's important to know.
Yes, and you actually need to look at the cost difference, because if it falls under Part B, instead of a flat rate under original Medicare of $1,156 for 2012, you're going to pay the annual deductible in 2012 for Part B is $140, which, by the way, did lower from last year.
Yeah, that is lower.
It is lower from $162, and then you're responsible for 20% of the surgery.
It's all about trying to figure it out and making sure that you pay attention when you get close to that age, or if you've been disabled for a while. I have a son that was on disability. What are some of the other programs that in your department that help Medicare beneficiaries?
Well, we have what's called the Senior Medicare Patrol, which covers fraud and abuse within the Medicare program. And how this works is we have a group, of course, all of our volunteers are certified in this program, as well as our state health insurance assistance program, which covers the Medicare portion, to assist clients in filing complaints with the state, for the state to research and investigate any wrongdoing within the Medicare system or the state system, Medicaid, which in Arizona, of course, is Access.
Well, and I think it's important to note and I had an incident with my insurance company last year with a billing, and you need to pay attention to the billings. Are you being charged for something that didn't happen? Etc. Sometimes it's just a miscommunication. It could be an error, typo, but it could be fraud.
Absolutely, but you see, you have to prove fraud, of course, and in almost all cases, once it's confronted and it's brought to their attention, the coding is almost always changed, and then the problem is in most cases solved. And that's what we do. Is we go in and we'll assist with the contact the provider maybe and bring it to their attention that the issue is happening. Maybe the coordination of benefits might have been out of context and needed to recorrect that before it was resubmitted to where it would be billed correctly. These are just some of the issues that can solve those problems. But again, if you can look at something like your Medicare summary notice and you see certain things like double billing, maybe triple billing of the same item that you only had one service of, this could be a possible fraud. And this is another case where we would report this to the state for investigation to make sure that the Medicare money stays in there to keep Medicare insolvent for a longer period of time.
Well, another thing we haven't even mentioned is that I bet you have opportunities for volunteers. It sounds like the volunteers get quite a bit of training.
Absolutely. In fact, our program really couldn't exist without those volunteers. They are They are the heartbeat of what we actually do in this program, and I can't thank them enough for the work that they do out there with our clients.
So, and I know that again the training's extensive. You work around their schedules to get them trained, and I think it would be interesting to volunteer for this program because you're learning about Medicare for yourself and your family. You're able to help folks work through problems. I think some problem solving talents, etc., could be utilized. So if they want to volunteer for your program, they could also reach you at the toll-free number.
Absolutely, and we can give them the schedule of times for the training and the details.
Excellent, because I think that's important to note as well. I know that you partner with other organizations. Quickly, maybe a few of your partners before we wrap up.
Well, of course, we're we partner with the Department of Economic Security, which is where the majority of our information comes from, and then of course there's access. Social Security is a major part. In fact, Social Security and Medicare is pretty much under the same roof. They're just in two opposite ends of the house, so to speak. and then of course the providers and organizations throughout all 4 counties, several of them that we partner with and assist. In fact, we partner for presentations and educational events at their locations, and it's just amazing how well that we work together to help spread the word. And
I think also just point out that folks can also go on NACOG.org and click on Contact Us, or they could also click on information about the Medicare program right on our website as well. So it's www.nacog.org. Or you could contact yourself, do a little exploration on www.medicare.gov.
Yes.
Which is a little bit different. Or you could call Frank Brown at our toll-free number 877-521-3500. Thank you, Frank, for being with us today. I really appreciate you bringing me up to date on the many, many changes. If you need help, give us a call. Again, thank you very much for joining us today on Senior Moments Successful Aging.
Thank you, Mary.
Thanks, Frank.